The story is simple. My roots are in Africa. I'm from Ghana originally. So having gone to the US, had my education, worked for major pharmaceutical companies, and with the dream of setting up a similar type of operation in Ghana, it was easy then to make the decision finally to come back.
Dr. Paul Larty and his wife Alexandra Graham studied and worked for many years in the United States. They both had senior positions at well-known pharmaceutical companies. They lived a good life, but still decided to go back to Africa.
The issues are in Africa. When you have such a high disease burden, and the problem is availability and affordability of medicines. If you've gone through the training, you have the experience, you've had the exposure to ways in which to make medicines, I think it is important to come back to where the situation actually is, because once you are in it, then you realize how dire it is, and you can also identify the right ways in which you can help. So for me, it was very important to come back, establish a pharmaceutical business, establish it with the right kind of standards, with the right kind of technologies that could help with the solving of some of the disease burdens that we have.
Just north of Ghana's capital, Accra, they started the LaGray chemical company. They constructed a top-end facility for research and production of pharmaceuticals.
It was specifically designed, built, and operated to meet international standards of good manufacturing practices.
Well, the one new thing in West Africa is the technology for active pharmaceutical ingredient manufacturing. The active pharmaceutical ingredient, that is the actual medicine in the preparations that you take. That technology didn't exist before in West Africa. And in fact, in sub-Saharan Africa, it's right now only LaGray and a couple of companies in South Africa that have the technology to manufacture pharmaceuticals from beginning to the end. In other words, starting from commodity chemicals, going through the active pharmaceutical ingredients and then the final forms.
So we have made a difference. We've not done it on a large scale, we've done it on a very small scale, but we have shown the feasibility that it's possible for us to do this here, it's possible for us to be self-sufficient. That's the important thing.
The important thing at LaGray is that we want to be able to go all the way down to drug discovery at some point in time.
The expectations are high, but the start is difficult. The owners suffered sleepless nights because of the severe challenges. Many times they ask themselves why on earth they started this business.
There isn't a word like impossible in my dictionary, and so it's a question of perseverance. We know that we will make it happen, and so there was never a question, not till now, of we'll pack this all up and go back to the US now.
My viewpoint is that if you are outside and you've learned things that can help, if you came back and you apply those things that could help, you should try and come back. Granted, it is challenging, but in the final analysis, this is home, and you have to try and make things better.